Now that winter is upon us, the flu season is here, and as you are all aware, flu is a nasty viral infection which can especially affect children and the vulnerable quite badly. The flu spreads quite easily in communities, and one of the things that makes it spread easily among the vulnerable groups is, for example, if children get the flu, they're not as careful as adults in terms of washing their hands or wiping when they're sneezing or coughing, covering their mouths, etc., which then leads on to an easy spread of the virus in the community. If the children are immunized or are vaccinated against the flu, this helps prevent the spread of germs much more than if an adult was done. Environments like schools, playgrounds, etc. are a common place where the flu virus can spread very, very easily. Immunizing children not only helps prevent the illness in children, but also the spread of the virus in the community among the vulnerable groups, as we were saying, for example, grandparents or other elderly patients or elderly people who do have other background illnesses who come in contact with children. The flu campaign for children this year is targeting children of the ages 2, 3 and 4, as well as school-going children until year 3. The younger children are at a higher or have a higher chance of spreading the virus in the community if they get the illness, as well as they are more vulnerable as their immune system is developing. Now, the flu vaccination is not like the other vaccination your child gets. It is in the form of a nasal spray. So this might be just like a nasal spray they use for hay fever, for example. So it is not painful, and it's a fairly straightforward procedure. Now, the virus that is used will not cause flu in them as well, mainly because it is an inactivated virus that is used. So the common question we get is, will I get the flu from the flu jab or the flu vaccination? And the answer is no. Now, the flu vaccination along with children is also recommended for people with long-term conditions, and especially children with long-term conditions will need to have the flu vaccination. It can be quite a nasty illness in some people, especially the vulnerable groups that we mentioned earlier on, children with long-term conditions, etc. You do need to check with your doctor regarding children with long-term conditions or on other medications what type of flu vaccination your child needs to have, because the nasal spray might not be suitable for certain groups of kids. Now, the reason why flu vaccination needs to be done every year is another question that we get asked, because most other children's vaccination is once in their lifetime and they get immunity. This is because the flu virus tends to change every year, and so does the vaccine, and hence the cover that it provides against the seasonal flu is more effective during the year that we use it. The immune system does not recognize it from one year to the other. For this reason, every year the flu vaccination is also changed depending on the strains of the virus that is circulating in the community. Any further information about the flu vaccination or the National Flu Program, the NHS Choices website is a very good resource, and so is the Basildon and Brentwood CCG website, which you can find quite easily on the internet.